Hi, everyone. Welcome to today's session. This is our second session about our technologies that we have here at Omni-Health. So thank you for joining us today. I know there's a couple of people who will still be joining us in the next 1 or 2 minutes. So we'll just wait. Maybe we'll just give it 1 more minute before we kick off, April.
Okay, sure, no worries.
So we'll just wait till, exactly 1 minute and then we can start. Okay, I think we can kick things off. Welcome everyone again to today's session. This is session 2 of what we will be running. This will be a regular sharing session in this style of format. The idea is we just want to be able to share certain new tech and new solutions we have for the Australian healthcare and aged care industry. Today, specifically, it is about the Australian aged care and some customizations that we have done with our Temi robots. And where there are some integrations, April will share with you as well. But the idea here is basically this is just a session to share with you what we've done. And if you have any questions, please feel free to put them through. If you're using your computer, right at the top, there is a Q&A section where you can type your questions in. If you're using your mobile phone, there will be an option at the bottom, I believe, where you can click the 3 dots if it's not already showing up. You can ask more, and then there'll be a Q&A. You can type your questions in. I will keep having a look at the questions. And right at the end, me and April will then jump in and answer any questions you might have. And there were also 2 or 3 questions that were emailed in before this session. So we will also answer those if they don't come up or if we feel they're relevant because they tie into the other questions. So please feel free to drop your questions in at any time and we'll address them at the end. And if we're not able to address it at the end, not an issue. There's our contact details at the end if you have not met us before. But if you have met us before, then feel free to reach out to myself or April over LinkedIn, email, or our mobiles with those questions, and happy to answer them and maybe might find out more problems that we can assist with providing the solution for. And I'll hand it over to April with that.
All right, thank you, Suresan. So again, hello everyone, and welcome to our second session of Omni-Health Online Demo. I'm glad you could join us today as we will explore together how the Temi robot can transform and enhance healthcare and aged care solutions using our Temi Hub app. Before we begin, let me ask you a quick question. How many of you have ever wished technology could actually make healthcare easier, not harder? Right? That's exactly what we're going to show you today, transforming care with smart technology. Well, what is the Temi Hub app? It is more than just an application, it's your smart care companion. Think of it as a tool that connects carers, residents, and visitors in one seamless experience. By the end of this session, you'll see how it can save time, engage users, and improve service quality. Let us go through the Temi Hub app by watching this video.
Hello, this is Temi. And this is the Temi Hub app. In your screen is the home screen interface where buttons for way guiding is shown. Also, other buttons include survey, lockers, tour assistant, social or games and setup. First, let's talk about the social and games. This feature can be customized with the different apps you want to use, such as games or YouTube videos. This is a password protected so that not anyone can use without the admin personal assistance. Now, let's check out the setup. It is also password protected so that admin can only access it. In the screen, you can customize the home buttons, dynamic mode, tour buttons, integrate and manage flick buttons, chat settings, document locker setup, social and game settings and reports. Survey button can be customized on how many minutes you want it to run and in which specific location in the facility. On the home screen, you can customize the buttons and sub-buttons to match your specific needs or preferred locations. This feature helps visitors find their way in the facility.
Please follow me.
You can add music or any customized audio while Temi guide the visitor.
We have arrived. I'm returning to home, thank you.
All right, there you go, ladies and gentlemen, a solution that is designed to improve aged care and healthcare experience. This app combines automation, engagement, and communication to make care delivery smarter, more efficient, and more enjoyable for residents, carers, and the facilities. Now, of course, it's also a smart companion designed to integrate care, communication, and convenience. Let's explore some of the key features of our application. Imagine you're a visitor entering a large facility for the first time. With a single button, Temi can guide you to your destination while playing calming or upbeat music or providing updates along the way, and that is the way guiding. Now let us also imagine together a visitor walks into your facility, but staff are not available. Instead of waiting, Temi detects the presence and immediately greets the visitor. And it doesn't stop there. Temi can play engaging content, provide sequence based on your requirement, or quietly shift into standby until needed. Also, entertainment and social activities are not just that. Care isn't just about safety, it's also about joy. Temi provides games, trivia, and videos, or any app that would help engage more with residents for social engagements. Now let's also think about this. A new visitor wants to explore your facility. With the tour assistant using the tour buttons in Temi, it can provide a guided tour, playing orientation videos, sharing information at each stop, and escorting them around. Let me ask you this question. How would you feel having a useful guided tour in your facility for your visitors or new residents? Right? Temi will be a helpful tool with you. Also, feedback is crucial. With a feature like Service in Temi, facilities can collect real-time input from residents and visitors. And finally, here's something practical, the document locker. It securely stores important files like care plans, any important documents. With the help of Temi, it makes them instantly accessible to other parties when staff is busy with important things. And here's a quick thought. Would not it save time for a reception to send the files to different offices without leaving their desk? Right? So Temi would be a great help for your facility. Temi Hub isn't just about technology, it's about smarter care delivery. So why get the solution? Of course, it saves carers or staff time with automation. It also boosts engagement through entertainment and social activities for residents. Plus, it improves service quality by capturing feedback in real time. So that's everything, folks. And hopefully, this solution could help, healthcare and aged care solutions in your facilities. Now it's time for the Q&A, and you can find the Q&A button on top of your screen, or if you're using a mobile, you can see it more options below. So if you can have your questions now, and we could happily answer them. So Suresan, is there any questions coming in?
Okay, I'm just loading. The Q&A section is loading for me, but there were two questions that were emailed in. One was from an occupational therapist. So an occupational therapist who works in an aged care residential facility and has had past experience with working with children who required care at home. Children under the age of 10 who required care at home. That's the background. The question was basically, when introducing new bits of assistive technologies, there is a change that happens to the workflow that the therapist may or may not undertake. How does Omni-Health assist with change management, and is there any training that is provided when implementing these technologies? So I think I'll just answer that, April. So I think that question is, yeah, it's quite obvious. Any sort of any kind of technology, however advanced or not advanced, you would have some level of change happening. But the idea with what we designed here, and the reason why this Temi Hub application was customized for the Australian aged care, was so that as much as possible, the current workflow is not impacted, and it simply plugs the gaps that the current workflow may have, that staff in that area feel are gaps. It plugs those gaps. But where the technology can be brought in to enhance the workflow, then yes, there will be some change. There will be some training needed to use the technology. And we at Omni-Health will provide that training and will support the facility through that change management if that is something that you require our support for. Again, we don't want to be intrusive, but at the same time, we want to make sure we can support the facility as much as possible to make sure that change happens. Secondly, where training is concerned, there will be training for the therapists, in this case, based on this question, who might be using the technology. There will also be training probably for staff who are doing the daily cleaning of the equipment. Just like any piece of equipment, it needs some level of wipe down and dusting down and pushing around to make sure there's no debris stuck in the wheels and things. So we will provide those different trainings for the different user groups. And then again, if there's also IT side where, like in the Temi Hub app, there's some configuration that can be done. Either we can provide that as a service where we set it up and it's configured to work that way, or if there are changes that are needed, if there's a dedicated product champion in the IT team, then we will provide that training again to set up the settings on the Temi robot itself. The second question that came in was from someone who has a registered nurse background. This is a retired registered nurse who worked in South Australian and Victorian aged care and hospitals as well. Okay, so that question was, it's actually kind of similar, was with the new technologies, will there be time savings, and how can we justify that there will be no impact to safety of staff? Okay, I think, April, I'll answer again. I think time savings, it'll be very obvious. It can't be quantified without implementing it because you have to see a before and after. So if we were to do a workflow study and there were specific tasks that currently, like if I take the Temi Hub app, there would be a tour where now the Temi robot could perform that completely on its own, or it could perform it where it assists someone, where it does part of the tour and the person does the rest of the tour, or it could take people on an extended tour after they've met the placement coordinator who's done a small part of it. That's why it was designed the way it is. So there will be time savings in that way. Then if you look at time savings from the point of view of you want to get out certain survey feedback, certain quantity of feedback, but there isn't currently the time and the human resource to go out and get that information. Again, by using the Temi Hub app, you can now get that information. So in that way, you've now got more information with the same amount of time. So I think the time saving question, sometimes it is actually spending less time. Sometimes it's saying, well, you at this point in time do not have the resources to do it. By having this in your same 24 hours, you will now have the resource to get back that additional survey data or the additional moving around and the robot being able to greet people and just play some music and add a bit more sound and joy around the place. So in that way, time savings without bringing in additional human resource. And the second part of it was about impact on safety and justifying it. Now, these robots moving around is one element of the safety concern. And I think another element of the safety is there's a piece of software. So is there any safety there, safety concerns there? With the moving around, these robots are equipped with a whole range of sensors for longer distance and shorter distance and different heights to view obstacles. And the obstacles will be moving obstacles, if it's people, a wheelchair, someone with a walker, any of those things, or fixed obstacles, a table, a chair, someone just standing still because they like standing in a certain place, looking out the window and things like that. So the safety sensors there will prevent any form of collision. You set the distance, but there will always be a minimum distance. So generally within about 0.3 meters, it will avoid the collision. You can obviously extend it in some cases, reduce it in other cases, but it's not going to be 10 cm or 5 cm before it sees an obstacle that's ahead. Now, if the obstacle jumps out round a corner, then of course, much like any human walking round a corner, you only receive that information late, you will react late. But there is guaranteed to always be a reaction because the sensors will pick up different height obstacles and different distance obstacles. And these devices are used all around. I mean, thousands of these units have been deployed around the world. So in that sense, it's a very mature product. It's not a prototype. It's not something that's going through testing at this stage. It's a very mature product that's used in healthcare, in schools, in hotels, in exhibitions all around the world. So for that point of safety, I think that's fine. And the second bit with safety, if I read into the question, maybe the concern may be about software and cameras. Again, this is a piece, it's like an Android tablet. It conforms to all of Android's security requirements. The software, that Temi Hub in particular, is not capturing any personal data, any data that can identify an individual. Temi has the ability, if you choose to do so, to use facial recognition, but the way it has been designed, you have to opt into that. So by default, there is no individual identifying information or personal data that is being stored or transmitted anywhere. So in that sense, security is not a concern, if that is the safety concern. Those are the two questions that came in April. I don't see any other questions popping up in our Q&A bit. Let me just check if it's popped up anywhere else. Nope, nothing in the chat section.
Well, that's fine.
April, maybe then I think one of the things that it's important we address as well is Temi Hub and how it got to where it is today. Maybe if you could explain the journey of Temi Hub, how it started and what are the future plans for it.
Well, okay, that's a great question, and to start with how we were able to come up with this application. Well, of course, with our previous requirement from our customer, they wanted to have someone that could help them if there's no personnel available or reception available. Someone could help a visitor in a facility guide them to a certain location. And also there's also one requirement before that, if they wanted to give a tour and give them a certain video presentation, so Temi could help them give that, while doing the tour. Temi could show them something while presenting each locations of that facility. And then it also came out that a requirement of having this document locker. So like, for example, a reception, instead of leaving their place, they wanted someone or something or a technology that could help them brought that document to a certain office or location. So that's why we came up with the document locker. And also, there's also a requirement that they wanted to know the feedback of the visitors, and also the residents. So that's why we came up with the survey built into the Temi Hub app. So that's why all these features came into one application. So hopefully this kind of solution will help them reduce the staff workload and, of course, improve resident satisfaction and engagement, as well as contributing to a long-term cost savings to the facilities.
I actually think, April, one of the other important ones is also the flick button integration, where on your Temi Hub app, you've also got the ability to use flick buttons, which are a common device. I've got a few at home to turn on the smart light bulbs and things. So you buy those buttons, you either stick them around on the wall and they communicate either via Bluetooth or through Flick's own hub system. It communicates through that, and that connects to the Wi-Fi. And so you could be in any place in a facility, and the robot could be 10 meters away or 100 meters away. And if you are next to the button and you hit that button, the flick button, you can trigger the robot to move to your location and execute whatever task it may be. So I think that is very important, because when we started, the Temi Hub was to interact with it, you had to be in front of the robot to trigger it to go to places. Now you could be in other locations and you can still trigger it to head to those locations and perform the same actions, which gives a whole lot more benefit because of the mobility, and you're not constrained by where you are in relation to the robot.
All right. Yes, I guess, yes, that's the one important feature of the Temi Hub app too, Suresan. Thank you. So I guess that's it. So if you have other questions, please feel free to book us a call or visit our website so you can see it on your screen. So thank you for joining our demo today, and we'd love to hear your thoughts and feedback. So just a quick question, and if you could also give us, an email feedback, what features stood out most to you? So remember, with Omni-Health and robotic solution, we're not just talking about technology. We're here talking about transforming care for better. Remember, Temi is here to assist and augment your care teams, not replace them, helping you focus on what matters most and personalize compassionate care. So if you have any other questions and you want to explore how Temi can fit into your specific setting, please don't hesitate to reach out. But before we end our session, let me also show some of our robotic solutions. So we also have a cleaning robot. So this is it delivers consistent hygiene to reduce infection risk and minimize exposure, automate repetitive tasks to free staff and focus for higher value work. It also operates tirelessly around the clock, even at late night, and it also provides lower operational costs. We also have this delivery robot, which is autonomous mobile service robot, which is are highly versatile, handling different materials like linen, clothes, waste, consumables, and food. It can operate automatically or on demand, integrates with facility infrastructure, and can work with existing enterprise systems. And lastly, our other technologies such as our fall detection smart lights and mat sensors that monitors vital signs and movements. Do you have any additional information about this, Suresan?
No, I mean, what we do with all of these different devices, it's about integrating it. And again, much like the Temi Hub, building on problem statements that we are presented with to make sure that the product is a solution.
Yes. All right. So again, to know more about the solutions, you can contact us. Details are on your screen. And thank you again, and we look forward to partnering with you on this exciting journey towards smarter care. So hopefully to see you next on our next session.
Bye, everyone.
Bye, everyone.